My group was Standards of Rigor for Program Evaluation. Generated lots of exciting discussion. It was Becca and Tom Cook and Jens Ludwig. I think that there were several things I want to say before or as part of this. First of all, I'm a prevention scientist. I'm not a cost-benefit analyst. I don't do economic analyses. Fortunately, I work with Margaret Kuklinski, who does. And in our work, it's just been so important for us to be able to ask this question: is there a benefit that exceeds the cost of what we're doing? What we do costs a lot in human and financial capital, and the question is it worth it to do this? And I've been asking this question for a long time, and when we try to answer this question, Margaret and I find that we don't have clear guidance for how to answer difficult questions that will make a big difference in what the estimated benefit cost ratio is and whether it's a net present yes or no. And so this session has been wonderful for me because it gives me the belief that we could, in fact, a group of economists and cost-benefit analysts and prevention scientists and other social and policymakers could come together and actually give guidance to people like us who are trying to do research and trying to do a good job of benefit cost analysis to determine what are the benefits versus the costs of the intervention. Clearly, our group was really on a very important topic, which is what are the active ingredients that you can put into a benefit cost analysis? What are the standards for the studies that need to be done? And I think we did reach yesterday a degree of agreement that although we aren't going to call randomized experiments the gold standard, that they do help address a lot of threats to internal validity if they're well conducted, and it's possible to determine how well conducted they are. But Becca really reminded us that that isn't enough just to focus on that. You really have to focus on other issues as well, and this is when I say focus on it, I mean both attend to it in the conduct of the research, but also in the reporting of the research. Including, as we've said several times now today, what is the counterfactual against which this is being compared? What is the context in which this has been done? If we don't report these things, it's very difficult for other people who are thinking from a policy perspective about whether this is promising or not to really to make a decision. And similarly about the setting and the comparability of the setting in which this was delivered to potential settings in which it might be delivered. That also led both to the prior discussion and also the discussion in our group about what should we report. What should we report in terms of the cost-benefit analysis? In our analyses that Margaret discussed, we ended up saying, well, we're just going to report statistically significant findings. I came away from our discussion yesterday thinking that probably wasn't maybe the best decision given what people were saying about the reporting of all the findings and the potential for actually cost-benefit studies reporting. Dan really caused me to think about this, the potential for cost-benefit studies that report all the findings to really help us solve this file drawer problem of studies that, because they didn't have any big positive findings, get put in the file drawer, but people who had serendipitous secondary findings get published, and all of a sudden we think this study, which wasn't designed for this outcome, but in fact appears to have produced this outcome, suddenly we begin to think, well, maybe we can do this for that purpose, and without replication, it may be a result of the selection of the studies that are included. And so I think helping people like us understand the importance of reporting all the findings in benefit cost studies will actually help the field a great deal and really help potentially solve this, this file drawer problem. I think Becca came away from her presentation, although she got it cut off while she was trying to do it, saying we do have these lists or these systems like the What Works Clearinghouse, and we can start there with thinking about what are the standards of rigor that need to be met. And it was really nicely followed by Tom, who said, yes, and those standards, I agree with all those standards, and those designs are good, and how you have to conduct those signs are good, but I also think there are additional designs that really need to be included and considered. And that was the point that I think that you were making earlier, Brooke, that we can't just say it's only this. And that's an interesting problem for us from a policy perspective, just because, as we know, John Barron and the Coalition for Evidence-Based Policy has decided to draw this very bright line in order for policymakers to not have to deal with the complexity of interrupted time series designs or regression, discontinuity, or anything else, but to be able to say, I understand why this is good, and if it's well conducted, that I can have faith in the outcomes. But this is going to be something I think this consensus panel is really going to have to wrestle with. And provide some advice to us in the field. So I just want to, I came away with thinking about several things that I hope that if there is a panel that might be discussed in that. First of all, Anirban has been just really helpful to us all, and Steve illustrated it yesterday, and many people have talked about the importance of expressing uncertainty and how to express uncertainty. Second, this issue of what could be, I think Lynn said it, or someone in that panel said, who said baseline, kind of the idea of baseline reporting, and then you can report what's around that. But when it comes to issues like discount rates, et cetera, that if we could find some consensus, maybe that varies even by particular subject areas about discounting, that would really be an important thing, even if in addition to that we need to talk about other discount rates, because I'm now talking about other people's things that had influence on me, but when Dick was talking about this private sector investment issue, as people begin to get interested in this issue of social impact bonds, there's a new standard that potentially is going to be applied by the Morgan Stanleys or whoever decides to get into private impact bonds, and they're going to want to know, do I get my 8.5%? They're not going to care about the consumer part of it as much as the investor part of it if we're trying to get private sector investment in this. So it seems to me that although my first reaction is, oh gosh, Dick, if you make us do 7% discount rate, will anything be shown to be beneficial, cost beneficial? But I think it's really an important thing to think about, and that leads me to think that we may have to think about, and this is really Becca's suggestion, we may have to really be thinking about even different discount rates for different audiences. And so our consensus group may be made work, that whatever that consensus group, if it does get started, it may make their work more difficult, but there's a realistic issue that we have to deal with here. This question that came up this morning of discount back to when, is it when the program started? Is this the question of, I got this much money, how am I going to spend it this year, versus what would be the best way to invest in this population that was born this year? Those are two very different ways to think about influencing policymakers, and they're very, they're grist for the mill of a consensus study, I think. I think the last thing I want to talk about is something that just keeps coming through these things in this kind of low signal way to me, but it just keeps coming through. Jacqueline said today how what people want to do is fund it and then see did it work. And what I hear from Steve was when they funded functional family therapy in the state of Washington and said, let's put it in place, they decided to do almost a randomized study. It wasn't exactly a randomized study, it was close to a randomized study in Washington and how that program was rolled out. And what they found when they looked at the results of who got it versus who didn't get it, it didn't work. In fact, if anything, it was counterproductive. There was an evidence-based program, the policymakers had put it in place, and there it was, and it didn't work. But they looked further and they said, what about people who actually implemented with fidelity compared to people who didn't implement with fidelity? And what they found is that people who implemented with fidelity were getting the outcomes that you found in the original trial, and the people who weren't were actually not getting them. You were seeing negative effects. What did that do? That led to our legislature actually being willing to put money into training and technical assistance and support for high-quality implementation. And as Gary said, the big risk of what we're doing is people are going to say, oh, I'm buying this, I take it off the shelf, I put it in place. If it doesn't work, the failure will resound in policy for years to come. And so somehow there has to be an emphasis on the full range of what it takes to implement the things that we are promoting through benefit cost analyses as part of the cost, and that has to be included and understood, because so often people want to invest in the program but not in what it takes to make the program successful. So I'm really heartened by this discussion. It's been a lot of fun for me, and I just hope that it could lead to this consensus panel, which I think would be wonderful for the field.